Welcome to The Explainer. If you're a new parent or about to be one, you've probably heard the word jaundice. And yeah, it can sound pretty scary, but it doesn't have to be. Today, we're going to break down that yellow tinge and turn that concern into clarity. And just to give you an idea of how common this is, look at that number. More than half of all newborns become visibly jaundiced. So if you see it, know that you are absolutely not alone. It's one of the most common things you'll see in those first few weeks.
All right, so here's our roadmap. We're going to start with just how common this is, then get into the science of what's happening. After that, we'll talk about when to actually worry, how doctors figure out the cause, and finally, the really effective ways we treat it.
Okay, let's dive into section 1, a very common color. We're going to really establish why this is something you see so often in the nursery.
So let's start with the basics. What even is jaundice? Well, it's just that yellowish color you might see in a baby's skin and in the whites of their eyes. But the why? That's where things get interesting. It's all about the body's amazing but sometimes overwhelmed internal recycling system.
That brings us to section 2, the science of jaundice. Let's get into the nitty-gritty of the biology here. It really all boils down to one specific substance in the body. And that substance is called bilirubin. Think of it like this. Your body is constantly breaking down old red blood cells to make new ones. Bilirubin is the yellow stuff that's left over from that process. Normally, your liver just grabs it, processes it, and gets it out of the body. Simple as that. So why is this such a big deal for newborns? Well, it's kind of the perfect storm. First off, they're born with a ton of extra red blood cells. Second, those baby red blood cells don't last as long, so they break down way faster. And third, a newborn's liver is, brand new. It's still learning the ropes and isn't super efficient at clearing out all that extra bilirubin. That temporary pileup is what we call physiological jaundice. Now, this is really cool. There are actually 2 forms of bilirubin. On the left, you've got the before version, unconjugated. It's not water-soluble, which means the body can't just pee it out. And because it's fat-soluble, it can be toxic if the levels get way too high. The liver's whole job is to turn it into the after version on the right, conjugated bilirubin. This stuff is water-soluble, totally harmless, and ready to be flushed right out of the system. Okay, section 3, when to be concerned. This is the big question, right? We know some jaundice is normal, so when does it cross the line and become a potential red flag? This is it. This is the reason doctors and nurses are so vigilant. The main concern is preventing a rare but very serious condition called kernicterus. This is what can happen if those levels of the toxic, unconjugated bilirubin get so high that they cross over into the brain and cause damage. And the potential consequences are really severe. We're talking about things like cerebral palsy, learning difficulties, and hearing loss. This is why everyone takes it so seriously. And thankfully, because of modern monitoring and treatment, kernicterus is extremely rare today. So that leads us to section 4, investigating the cause. If a doctor is concerned about a baby's jaundice, how do they figure out what's really going on? Well, it's a pretty logical process. One of the biggest clues is simply the timing. If jaundice shows up in the first 24 hours of life, that's a big deal. It signals that red blood cells might be breaking down too fast, and that needs an immediate look. If it pops up in that classic 2-day to 2-week window, it's almost always that normal physiological stuff. And if it sticks around for more than 2 weeks, well then doctors start looking for other things, like an infection or a possible issue with the liver. And here's another really important clue, and it's not about the baby's skin, it's about their diapers. If a baby's urine is very dark or their stool is pale and colorless, that tells doctors something very specific. It means the liver is doing its job conjugating the bilirubin, but it's getting blocked on the way out. That points to a completely different set of potential problems. Okay, and now for our final section, pathways to treatment. And here's the best part. For a condition that's so common, we have some really simple and incredibly effective ways to manage it. Management is like a ladder. You start at the bottom rung. First, just regular visual checks. If there's any concern, step 2 is getting an actual measurement, either with a quick scan on the skin or a small blood test. It's only if those numbers cross a certain line that you move to step 3, phototherapy. That last step, an exchange transfusion, is extremely rare and only for the most serious cases. So how on earth does shining a light on a baby fix an internal problem? It is so clever. Phototherapy is basically a biological shortcut. The special blue-green light goes through the baby's thin skin and does the job the liver isn't quite ready for. It zaps that toxic bilirubin and instantly changes its shape into that harmless, water-soluble version that the baby can just get rid of in their pee and poop. It's amazing. This quote really sums up the entire modern approach to jaundice. It's not about panic, it's about paying attention. Because with careful monitoring and acting when needed, this super common condition almost always ends up being just a small temporary footnote in a newborn's story. So what's your job in all of this? Honestly, it's being the most important set of eyes on your baby. You're the one who is with them the most. So by going to all the checkups and just knowing what to look for, you're partnering with your doctors and nurses. You are your child's first and best advocate. And that's an incredibly powerful thing.